Good afternoon, everyone. Thanks for joining us a little bit after 3. We want to get to a couple bits of information. Remember, if you have a question and you're watching, just write it in that comment section below the live feed. We'll try to get through as much as we can today. Let's jump right to the Dutchess County numbers. So we have those. A little bit better news in the positivity rate. We've dipped a little bit, right? We were a little bit over 5% these last 7 to 10 days. We're now at about 4.5%. Now again, we are seeing and have seen increases in the active number of cases, but we also want to monitor positive cases versus the total number of tests in any given day or week, and so that does impact the positivity rate. But that said, we've sort of plateaued. We were at below 3% for a day or two, and then of course we started to tack upward. We feel a little bit better this week than we did last week as far as numbers, but to go over those quickly, we are at 1,405 active cases that the health department is monitoring, 59 individuals hospitalized. That's a slight increase over last week, but we've been in this range of between 45 and 60 over the course of the last several weeks, and we certainly hope the best for every one of them. 425 individuals have succumbed to the virus. That is, I think, an additional death since last week, and of course, we share that heartbreak and extend our very best to those individuals who live on with loss. As I said, the positivity rate, 4.54%, is our current number, and that is a little bit lower than it was a week ago. So that is, again, we said we'd plateau. We're, obviously going to watch some of the travel this last week and some holiday activities. We'd ask, obviously, to stay vigilant. Remember to follow those basic mitigating steps that would keep us safe. Monitor your own health. If you're not feeling well, it's certainly not the time to necessarily travel and potentially get someone else sick. No matter what it is, you don't feel good about. But nevertheless, we're going to continue to monitor to those numbers. Last week, again, I said it. We were a little bit concerned. We expressed that. I'd say we're a little less concerned this week, but we still want to be very focused on getting through this period. And as folks get vaccinated, as we get into the later spring months, we're hopeful that the numbers just start moving again in the downward direction. Talking a little bit about vaccines, we have now exceeded 30%. Very big, important step. 89,096 Dutchess County residents have received at least their first dose. That is 30% of the county's population, which is very, very promising, and we're very happy about the advancement. The opening of the 2 vaccine centers in our region, one in Orange and one in Ulster County, has created a greater access for residents in the region. And as I'll say in a few moments, we are continuing to see an increase in the dose allotment provided to our county. And so you should know that. I'm actually very grateful for the relationship we have with our partners. We are getting vaccines out into the community. We are making significant progress, and that's good. We obviously want more. Demand far outpaces supply, but we're going to continue. Obviously, we're going to continue to advocate for more vaccines and doses. But right now, 30% of Dutchess County's population has received their first dose. 45,292 individuals have received their second and/or the Johnson & Johnson dose. So they are fully vaccinated, and that represents 15.42%. And of that 45,292, I am one. Today I received my Johnson & Johnson vaccine. I signed up online through the state database. I registered with my office as one of the public-facing government employees that were qualified to be vaccinated 3 weeks ago. And based on the those in this office who wanted to be vaccinated, still needed to be vaccinated, my turn was this week. So today at a clinic we hosted in Pine Plains, I received my Johnson & Johnson dose. And I was saying to folks before, painless as far as I was concerned, as far as the shot in my arm. I will tell you, feeling a little bit, I don't know, just a hair a little bit on, I'll say a little bit off, which could be the vaccine or could just be me. But I tell you that because that was, I think that's my experience. A little bit off, a little, I don't want to say lightheaded, but almost as if nasally kind of a feeling. But I'm told the Johnson & Johnson doses, we've had no real significant reactions here in the county. But we want to obviously be sensitive to that. And going through the clinic was just a great experience. Very, very well organized. Our behavioral health staff, our Medical Reserve Corps volunteers do a tremendous job. But I was happy to sort of experience it as anyone else would, from registration to the 15-minute waiting. I did, however, break the rules. I was told that you had to sit for the 15-minute recovery, and the only time I sit is here now. I don't sit for very long, so I did stand up for a little bit. But very grateful for the folks there. Thankful to the Pine Plains School District, Marty Handler, the superintendent, and the staff at the Stissing Mountain High School, middle school, high school. I did a great job, and thankful to Legislator Pulver, Greg Pulver, who helped assist in getting that coordinated for us, and the supervisor, Dara Cloud. She and I were able to tour the clinic together. But we're doing over 350 doses in Pine Plains today, and I'll talk a little bit more about where we're headed next. But very grateful to be among now the nearly 16% of Dutchess County's population who has been vaccinated, and I took that step today. So talk a little bit more about, let's, Sean, go to regional positivity rates just as a reference point. I do want to point to that. As I said, Dutchess yesterday was 4.7. Today we're 4.8. 4.7 yesterday. Our 7-day average is 4.1%. But if you look at the region, important to note, Orange at 7%, Putnam at 5.2, Rockland at 5.4, Sullivan at 5.8, Ulster at 4.1, and Westchester at 4.0, Dutchess at 4.1 at the lower end of the regional positivity rate. And so we're just asking you to stay vigilant, continue to follow those basic protocols, those mitigating steps. Again, when appropriate, we want you to wear that mask. If you can be sensitive to people around you, obviously monitor your own health and engage in that physical distancing. But over the holidays, whether it was Passover or whether it be Passover or Easter, just try to keep those interactions kind of small, be around those that you feel comfortable with. But we're going to get through this. We're nearly there. So a couple questions. Let's jump to those, and then Sean, we're going to jump to vaccine distribution this week, just so you're prepared. Does the 30% vaccinated represent the whole population or just those eligible? That is actually the entire population. So it's 30% of Dutchess County's nearly 300,000 people who have been and received their first dose. Explain the county's notification system, targeted slots, or public links. I think I understand that question. So we want you to sign up at dutchessny.gov. /vaccine info, dutchessny.gov to sign up. Once you're on that waiting list, there's a couple things that happen. So that basically is an information email or text message that you will receive. Every week you're going to receive an email from us that says basic information about what's available that week. For the standing clinics, so for the ones that Dutchess County organizes for our health departments, 90% of those clinics are us contacting you, meaning if you've called in and there's an option for that, or if you're on our list and you're selected through the process to have your appointment at a Dutchess County Health Clinic, then we're either going to email you the link to sign up, or we're going to call you to sign you up. That's going to be directly to you. That's 90% of the appointments that we take at our health department. Some other, though, become available. So, for instance, last week we went from 800, I think, Johnson & Johnson doses to 1,000 Johnson & Johnson doses. And while we had certain appointments scheduled, we had the availability of some more. Sometimes, so with that information, we'll send out another email saying there's 200 appointments that are now available. Take advantage of them. We're just going to open them up, because going through the process of selecting, calling, and scheduling, keep in mind, we're creating a whole system to make this happen. So staff is constantly scheduling. So if we have a few appointments that become open, we may just send out the link and have you sign up. Like last week, I think we had 80 appointments that became available the day that we were doing them. So either cancellations or some additional doses became available that day. It wouldn't be impossible for us to find 80 people, schedule you, and so we just simply open it up, and anybody who gets that email can sign up. So again, 90% of what we do is through that direct email. Here's your appointment, your sign up. There are some from time to time that come out that become available. We learn of a pharmacy that has new availability and new appointments. We'll send you an email saying, here's the link for that. The state of New York opens up some availability at their regional clinics in Ulster, Orange, or Westchester. We might just push that out and say, here, sign up. And so being on that list allows you to be selected for the health department clinics, but then also receiving updates regularly as to availability. Another, for instance, right, you will push out information about pharmacies that have doses. Every time we give you a link, it's because those pharmacies were assigned doses from the state of New York. Now, sometimes you may click on them and they say, oh, no, we're not doing them here. That is their decision. They may decide at a local pharmacy to reroute that. In fact, to take 50 doses from LaGrange and send them to Hyde Park. That doesn't get communicated with us. So we'll say, reach out to that pharmacy, try to connect. And yes, if you're going through a pharmacy, they're going to ask you to sign up in a multiple number of ways. That's the system that the state has created. There's no centralized point of appointment making, and county governments are not permitted to offer that. So we don't have the ability to kind of centralize all the appointments. We can only give you the appointments available through the county's health department. So I hope that was a little bit helpful. Was the Pine Plains site public? You never got a notification. The Pine Plains site was public, but it was, again, if you're on the county's vaccine info list, that's we pulled names from that list. So a random selection from that list gets selected. Pine Plains, 350 appointments. They were selected from that region. So I think, just as a reference, Pine Plains, Milan, Clinton, likely maybe not town of Northeast, but those communities, we would have pulled names from our list. But that includes hundreds and hundreds of people. And so that could have been homebound seniors that were through the Office for the Aging that lived locally. That could be the direct vaccine information form that I just suggested you sign up for. We would pull from that list. It could also be some essential workers. For instance, there were a number of school district employees that get selected. Now, not hundreds, but a number of folks that were from that part of Dutchess County who then received that information. And so you would be told, right, if just because you live there doesn't mean that we could get to you, but you would have been in that mix to be selected. And just keep an eye out. There are going to be more appointments. We're going to be doing more of these kind of pop-up clinics. And so we're getting to you. And somebody wanted to give a shout out to Pine Plains Pharmacy. Good job. I agree. Nasir, right? Nasir? Ahmoud? Nasir. What's that?
Nasir Mahmood.
Nasir Mahmood. I remember. I see. The vaccine has kept me from thinking of his name. Nasir does a great job and a really good partner. Helped us with substance use disorder, Narcan. Doing a great job with COVID. He was out there and very, very helpful. We'll get to a couple additional questions. Let's just jump now to vaccine distribution. You're going to be tired today. Our American Sign Language interpreter. Usually we have two. Is Diane coming? Diane's running late. So you're going to get a workout today. Did you know that I talk fast and long? I think I got it. Okay, vaccine update. Sorry about that. Let's talk about our the doses this week. Every week now we're growing, so we have more this week than we had last week. Jumping right to vaccine distribution for the county. This week, Dutchess County receives 4,900 first doses. So for all of the providers in Dutchess County, nearly 5,000 doses for first doses. That means 2,900 for the health department. Those are the clinics that I talked about and the ones I'll reference. 1,300 to local hospitals. They have a pool of people they select for appointments. 300 doses going to area doctors' offices, and 400 doses going to pharmacies. I do want to say this, in the case of all of us, right? So we're receiving 4,900 doses this week. That doesn't mean there's only 4,900 doses being administered. We'll talk about that in a minute. Because of the way these distributions happen, they overlap. So in any given week, we're giving more than the weekly allotment. But this week, largest allotment that we've seen so far, nearly 5,000 doses to Dutchess County distributors, including 2,900 to the county health department. We will be administering 7,800 doses this week, total, first and second. So nearly 8,000 total doses, largest amount we've done in a week for first and second doses this week. And this is going to be the breakdown, so we can take a look at that. So for this week, Dutchess County at our JCPenney and our Dover pods. So these are our permanent pods. These are the fixed locations. You get selected from that vaccine information list. 4,250 total doses being administered, and that's to essential workers, seniors, those with disabilities, and those other eligible categories. At our pop-up clinics this week, we did a Pine Plains one today. We're going to be in Poughkeepsie on Friday for another pop-up, 450 doses being administered in those pop-ups this week. And then with our partners, we'll be administering 3,100 doses countywide. That includes those that are eligible homebound seniors and patients, and then some other frail and vulnerable populations. So this is this week's distribution: 4,250 doses at our fixed locations, 450 doses at our pop-ups, 3,180 doses in partnership with other providers. And we're working directly with healthcare providers and others to get appointments scheduled. Okay, additional questions. Is it true second doses may not be needed for much longer? This is what I'll tell you what Dr. Wythian says. It is as more and more of us are receiving the first dose and being vaccinated, there is a body of study. Right now, they're studying the effectiveness. It would suggest that a 50 to 60% effectiveness in the first dose is a pretty successful vaccine. And so there is some discussion that there may not be, as more become vaccinated and more have been infected and survived the virus, that perhaps later in life there would not be the need for both doses. But that is not changed currently, but that is a body of study with some conversation about it. And I'm only offering to you what I've been told, right? I've read some of the studies, but that said, right now, the only way to be considered fully vaccinated is to have both doses of the Pfizer or Moderna shots or the single Johnson & Johnson doses. But what's being suggested is the single dose of the Moderna and the Pfizer is very effective, and therefore may not necessarily need to be two doses, but that is not determined yet and is not something that has been finalized nor announced. Okay, where can I get the Johnson & Johnson vaccine? We can only tell you who has vaccines. So in the case currently, Johnson & Johnson doses are principally distributed to the health departments in New York, outside of New York City. New York City, different beast. So outside of New York City, health departments are getting allotments of Johnson & Johnson doses. They, in Dutchess County, are generally the ones we use at our pop-up clinics. So if we're going to a location to have to set up 3 weeks later and do a second shot, not possible. So what I would say to you, we don't have the ability to have people pick which vaccine they want. That will happen someday. Someday that will happen. There will be more. Okay. And so that'll happen at some point. But right now, if we can send you the links to doctors' offices, to pharmacies, to the county health department. If you get selected for one of those appointments or offered one of those appointments, ask what vaccine they're giving. And if you don't want to take that one, you're welcome to say no. Now, our position has been all of them are effective. All of them are safe based on the studies that have been presented, and you should consider what you're offered. But that's your choice, and I'm certainly not here to tell you what you shouldn't do. But what I would offer to you is if you say no to one of those available appointments, you can certainly wait till the Johnson & Johnson doses become more readily available. But as of this moment, that is not happening, right? There's not broad access to the Johnson & Johnson doses, and this week doctors' offices are receiving some Johnson & Johnson doses. So you may want to speak to your doctor's office about that. The other thing I will tell you is that based on what we know, the J&J doses are being purchased more and more at the federal level, so at some point they'll be more widespread. But I have family members who have taken the Moderna shots. I have family members who have had the Pfizer shots, and I've had family members, including myself, take the Johnson & Johnson dose as I did today. So that is up to you, but that is that is currently the structure. I apologize. I dropped my card. It's the first time in 13 months I dropped a card. Well. Diane is back. It's okay. You're a little late. It's okay. I won't embarrass you any more than I just did. It's all fine. Now you have to catch up. Okay. Can someone get their second dose here if their first dose was out of state? The short answer is that is not easy to accomplish. If you received your first dose out of state, I would strongly suggest getting your second dose there. It is just not simple to get to the second dose had you gotten it someplace else. In fact, even in state, you really need to get your second dose with the provider who gave you your first dose. And a lot of that has to do with, first, we're only allotted the numbers of second doses for the numbers we gave out in first doses. So as an example, if today we did 100 Moderna shots, 3 weeks from now, we are given 100 Moderna shots to match those first ones. So we don't have the ability to say, oh, 3 weeks from now, if you got it someplace else, please come to the county health department, because we don't get those doses. The state of New York, their vaccine sites, their large sites, they do have capacity to take on second doses, but you've got to navigate their system. And as I understand it, and I know firsthand, it is not easy. So really, you should stick with whoever gave you your first dose. And I apologize for that, but just understand the health department, our health department, county governments, we're only given the same number of second doses that we issued for first doses. We don't have some allotment that we can get access to, and rearranging them is something that's out of our area. Okay, let's slow down now. Can vaccinated people visit hospital patients? That is up to the hospital. If you've been vaccinated, there are visitation rules, but those visitation rules are within the state guidance. And hospitals do provide, some hospitals are providing visitation. I don't know that ours have updated their visitation plans. We'll find out, and for next week we'll try to get that updated, but it is up to the hospital as to what they're approving for visitation. What towns were in the Pine Plains pod outreach? Much of Northern Dutchess, but I don't think Northeast, so I'm thinking Clinton. If somebody wants to let me know, they can. But Red Hook, Clinton, Milan, the town of Pine Plains, and there were a couple others. But if you weren't picked, if you weren't notified, it was because through the random selection we didn't get to your names. We were doing 350 doses there, and I would easily say there's a few thousand that would have been in that population. But it was the north. Quadrant or third of Dutchess County. I don't know that Northeast was in there because we're doing a Millerton pod in the next 2 weeks. Are the vaccines safe? People getting very sick after the second shot. I am not here to tell you what you ought to think. I will tell you that based on the information and the data that we have, I believe the vaccines are safe. Dr. Wythian, our Commissioner of Health, infectious disease doctor, says that based on what we've evaluated, the vaccines are safe. You should make that choice based on your conversation with your physician and your medical professional. What I can tell you is that there are individuals who have a reaction. There are a lot of people who have reactions. We've had, I think, two noted reactions to vaccines, meaning two instances out of the thousands that we've administered these last 15 weeks where an EMT, I think, had to assist an individual who became lightheaded. But not more than that based on our distribution. I will tell you, as I said today, I have no soreness in my arm, feel a little bit lightheaded, but other than that, that's how I feel today. But I will tell you that we've had physicians on, we've answered these questions before. There doesn't seem to be a serious reaction that's any greater than any other vaccine. That vaccines always have that potential, but what we've seen nationwide is that. And so I just encourage you. I just encourage you to speak to your physician, and if you have questions, feel free to ask them. We'll try to get you some answers, but overall, the evidence suggests that the vaccines are safe, but that is a choice you should make, and you should make with your physician. Why can't schools open in person full time? Schools can open in person full time. It's up to the schools, though. So in Dutchess County, we've advised them that there is not a requirement to meet a 6-foot distancing, that there needs to be some consideration for safe distancing. For instance, you wouldn't have kids pile into the hallways or fill up a cafeteria or a gym, but schools can open full time. They can be open full time. They can have full capacity. It's just they have to be sensitive to individual health and provide an option, in essence, an opt-out for those who who don't want to attend school. And many schools are returning. In fact, my school district, Red Hook, is returning to 4 days a week. They're going to stay closed 1 day a week for, I think they're doing like sort of, cleaning and what have you. The other is they built schedules. I know in my case, they built a schedule around this new, virtual and hybrid model that undoing it is probably just as complicated as establishing it. But that said, we've advised schools. We gave them that counsel. They have every ability to return to full time. It's up to the school districts to accommodate for safety, but there is not a hard and fast rule that says you must stay. There's a 6 foot physical distancing, or that you can't return to school. So that is permissible and permitted in the state. Great question. If you have no reaction to either shot, is the vaccine effective? Dr. Wythian answered this question last week. Yes, it is. Some people have a reaction for different reasons, right? You could have a mild allergy to some component or ingredient. You could have a reaction and some allergic reaction to the needle itself. People have that, and then certainly there could be a reaction to the vaccine beyond sort of initial allergic reaction. But if you don't have one, it doesn't mean it's not effective. It is effective. There is a suggestion that on the 2 doses, that on the second dose, that there are some who have a sort of a heightened reaction to it, and Dr. Wythian and the studies suggest to us, the evidence and medical professionals suggest to us that it's your body kind of saying, hey, I know what that is, right? I know that's not supposed to be here, and I'm supposed to get rid of it. I'm supposed to attack it. So that does happen, but again, just because there's no reaction does not mean it's effective. Pfizer approved for 16 to 17-year-olds. Will Dutchess County be getting Pfizer shots? The short answer is that's up to Albany and the governor's office in the state of New York. Right now, we don't receive Pfizer shots for county health clinic distribution. But this state is moving, I guess, April the 6th. Here it is. On April the 6th, anyone 16 years of age and older will qualify for a vaccine. Currently, though, you are correct, only the Pfizer doses are available for 16 and 17-year-olds, and those are only available at the state vaccine sites. That is not something that the counties have access to as of yet. If I got my first dose and second scheduled, should I opt out of the emails? Great question. You should. So there is an opt-out page. Please do that. Now, you won't opt out of getting emails because we want you to have the emails. You may have a family member that you want to advise. There's availability. There might be information that's useful to you. So if you go to this page, duchessny.gov/gotmyvaccine, duchessny.gov/gotmyvaccine, you can opt out of being on the call list. So you no longer take up a slot in the phone call list. We're able to do that. Now, somebody said to us online, and I think they were ridiculing us, well, I got my shot. Why can't you just take me out of the list? The short answer is we don't, actually. We know that we've scheduled you, but it's a different database. The state of New York manages the database for those who have received their vaccine, and they don't give us access to it. So we don't have a merger of that information. So we do need you to pull your name out if you wish. I mean, the very worst case is we're calling you and you say, no, I already got it. We move to the next name. But again, if you can opt out of being on our call list, that is helpful to us. duchessny.gov/gotmyvaccine. How are we handling homebound seniors? Great question. We are with the Office for the Aging and our partnership with a few healthcare providers are going to homes. If you are aware of a homebound individual, and it doesn't necessarily have to be a senior, but somebody who's not mobile, has a homebound has a difficulty leaving their home and is homebound, you can notify us through the vaccine info form. So when you go up and sign up on that form, if you click, one of the options is homebound. You can say you're homebound, or you can call 845-486-3555. 845-486-3555. Press 1. That'll give you an update on our vaccine information for the week, and then press 2, and there's someone who'll be available to take your information, identify yourself or your loved one as being homebound, and they will be scheduled through our homebound outreach effort from the Office for the Aging and our healthcare partners. Definitely happy to be doing that. If you've had COVID, do you have to wait for your vaccine? The answer is yes. The ideal is you have COVID, right? Once you've had COVID, you wait through the entire isolation period and that you are no longer symptomatic. So remember, you're doing those 10 or 14 days. You're monitoring your health. If you're no longer showing any signs, any symptoms, and you've been through the vaccine period, then you're free to get your vaccine. Correct? Did I get that right? As long as you've gone through the 14-day, the total isolation period, no symptoms at the end, you can then schedule for your vaccine. Now that said, what I will tell you is what Dr. Wiley has said. I mean, technically speaking, there's nothing that suggests you can't get your vaccine while you have COVID, except you don't want to be going to a clinic or someplace else to get somebody sick. So there's not a body of medicine or study that suggests that getting the vaccine while having COVID is an issue. It still will be effective in theory after you've lived through that experience. But obviously, we don't want you. You don't want to be in a setting where you might get someone else sick. So wait through the 14 days or 10 days. Make sure you're asymptomatic, and then you're free to get your vaccine. Let's talk a little bit more about our doses this week. As I said, 2,900 doses will be administered at our JCPenney's and our Dover fixed clinics, and those are our new our first shots. Additionally, we'll be doing a total of 4,250 doses at those two locations for our first and second doses. This week, we had our pop-up today, as I said, in Pine Plains. We also have one scheduled in the city of Poughkeepsie. We intend to be in Hyde Park and Millerton in the upcoming weeks, and then we're going to keep making the rounds. Our goal is to have basically two kinds of pop-up clinics. One is the larger clinic, like we had in Pine Plains today. That's in the 350 to 400 range, and that's a larger scale, but in a local setting where we'll be communicating and reaching out into the community to get folks scheduled for those appointments. And then we're doing some smaller clinics, like about 100 doses, where we're actually going to a senior living facility or maybe a community center where we'll be focused on a very specific population to try to assist to get those that may be less mobile and have less accessibility. As an update again, the state of New York updated the vaccine eligibility this week. Any individual 30 years of age and older is now eligible. So if you're age 30 and up, you're now eligible. And we do suggest you sign up at our vaccine information form. Beginning April 6th, as I said, 16 years of age or older. So every adult and everyone over 16 in New York will be eligible April the 6th. And all providers can provide vaccines to anyone who's eligible. If you're trying to find a shot for a 16 and 17-year-old, you are correct. The Pfizer shot is the only one currently approved and is available only at the state sites. And Pfizer is saying 16 to 17-year-olds, their shots are 100% effective. So good to know. As I mentioned, I'll let you come on in. There you go. As I mentioned, we want you to sign up at duchessny.gov through our vaccine information form. Give you that information again, duchessny.gov/vaccine info form. Sign up, get you scheduled through one of our county clinics if we can and when there's availability, but also by signing up there, you'll get updated information at those other locations. And when you go to that page, if you scroll down at our vaccine update, our vaccine information page, you'll see that there are links to other providers who have appointments available. Again, we're not able to centralize the appointments. We wish you could, but that's not the system that's been set up. But we can tell you who has vaccines, and then you'll have to go to those particular locations online and sign up. Make sure I've covered a few things. Rules on outdoor gatherings, a good question. Currently, it is 25 in a residential setting and 200 in public places. That is currently the gathering rules, 25 in a residential setting and 200 in a public place. If you have some time, we're doing a countywide survey on public transit. We welcome you to visit duchessny.gov/public transit, trying to get some additional information that will help us continue to expand and enhance our public transit services. And if you complete the survey, you will be entered to win a $25 Visa gift card. Isn't that great? You can win a Visa gift card. One of four Visa gift cards, $25. So sign up, complete that survey, and if you've completed that survey, you'll be in the running for one of those $25 gift cards. But that'll help us obviously continue to improve the system. What is the reasoning behind expanding eligibility when appointments are still so scarce? Great question. This is a decision that gets made at the state level. The truth of the matter is, I think we're at a point now where where there's so many single groups of people that were approved that frankly just opening it up and not requiring anyone to have to pick through different populations, right? So having a one clinic can only do for this population, one clinic only for that population makes it even more complicated. So the state decided to open up effective April 6th to everyone. Now the president did say the goal was for every American to qualify by May 1st. And so the expectation is that supplies will continue to increase and that at some point soon supply will meet demand and it won't be as difficult to get an appointment. But point well taken. The only thing I will tell you is, listen, we said this early on and I know it's hard to appreciate, but when we started the vaccine distribution, and again, counties have vaccine distribution plans. We are required to by state law. In fact, we're funded by the state of New York to create them. We were asked to update all of our county plans for the vaccine distribution for COVID-19. The state did not use those plans, and they created an entirely different structure. All of that said, when we started this process, we thought we would probably wouldn't be till fall that there'd be near universal accessibility to vaccines. We expect that will be by early summer, that by early summer supply will meet demand and we'll be out, we'll be in a position where anyone who wants one will have at least some ability to access one. And that might be calling your doctor's office and scheduling next week, but it will be a much easier system. That wasn't supposed to happen initially till late fall. We are probably 3 or 4 months ahead of schedule nationwide, which is useful. It's good, and I understand the frustration. But that was the decision-making process, and Albany and the state of New York make that determination. Somebody asked, when will we get back to normal? I don't know what normal will look like. I hope it feels a lot like what normal was, but better. Meaning maybe we'll be a little nicer to each other. But that said, I think we're very close. Meaning it does seem to us that we're moving pretty far along with vaccines as a country. That's good news. You're seeing some of the regulations being lifted. Yeah, we want to monitor cases, but again, we recognize we know more about the virus today than we did 13 months ago. People are willing to assume a level of risk today that they didn't want to take 13 months ago. All of that plays into how these decisions get made. But I would say to you, into this summer, we're going to start to experience something that resembles a lot more like normal. We're pushing for those things safely, and we're hopeful that into the summer we start to experience what feels a lot more like normal, only better. Normal plus better. If you have a question, add it to the comment section below the live stream. I would like to get to as many as we can before we close up. I do want to mention we are having a virtual public hearing on chemical dependency and some substance use services here in Dutchess County. That is scheduled for Thursday, April the 8th, 5:30 to 7:30 p.m. Please be a part of helping us develop, enhance, and improve the way we deliver those services. That's from 5:30 to 7:30 p.m. Register at dutchessny.gov/forum comments, but dutchessny.gov/forum comments, and you'll be able to sign up to participate in that public forum as well. We're scheduled, our next town hall meeting is Wednesday, April the 7th at 3 p.m. Wednesday, April 7th at 3 p.m. And then our next telephone town hall is scheduled for Wednesday, April 28th at 5:30 p.m. Now, I will tell you that I took to heart some of the comments online. Folks were poking at me that we call them too often for these town hall meetings. I apologize for that, but we try to use every tool we can to get information out. I'm very sensitive to not interrupting your dinner, but so you do generally get 2 phone calls, but apologize for that. But I hope you can join us at our telephone town hall schedule for April the 28th at 5:30 p.m. In the meantime, if you have a question, write it down. Try to get to any more. If there are any, write them down in the comment section below the live feed. Do want to mention, again, if you've not signed up for the vaccine information wait list, please sign up, dutchessny.gov/vaccine info form, dutchessny.gov/vaccine info form. If you need some assistance signing up for that, you can call or visit any of our libraries in Dutchess County. Grateful to the Mid-Hudson Library Association Tom Lawrence has lassoed them all and working all of our libraries together to assist. So if you need assistance signing up, you can visit duchessny.gov/vaccine info form, do it yourself. You can visit a local library by calling them or visiting them in person. They'll help you sign up. Or you can call our information hotline at 845-486-3555. Press 1. You'll get an update on vaccine information that week. Press 2. And an Office for the Aging staff member or volunteer will help sign you up for that information. Do you think we'll wear masks through the summer? I don't know. My guess is that people will still want to wear them. I don't know that they'll be as strictly required as we get through into the summer. And I certainly hope we return to something that resembles more of a normal activity. I don't have an answer to that. And every time I guess, I'm generally wrong. So I'm just not going to guess. But it does look like we're making good progress. So let's end on that vaccine, the percentages where we are in vaccine distribution. Just as a reference point, and this is at least positive, do we have the other county percentages or no? Not one of the slides? Okay, that's okay. So again, we're at now 30% county population having received your first dose. That's nearly 90,000 people. 45,000, nearly 45,300 individuals have completed their vaccination. I'm one of them. We are. I know the frustration is there. I know that people, either had to wait to get to one of our clinics, or you might be leaving the county. That is happening everywhere in the state, but we are making good progress, and we just ask you to be a little patient, and we'll be as helpful as we can. So with that, if you have questions throughout the week, always feel free to reach out to us. Visit duchessny.gov. Feel free to reach out to this office. We try to get to as many responses as we can. We're also scheduling appointments every day. They're doing it from this office, health department office for the aging, emergency, Department of Emergency Response. They're all working very hard to try to meet your needs and respond to your concerns and questions, and we appreciate your patience. So until next time, please stay safe, be healthy, and be kind to each other.